Hello! In this video, we will talk more about the levels of intellectual disability. At the end of the video, there will be a quiz based on cases. This can help you better recognize the levels of intellectual disability in an everyday setting. There is always the possibility to pause the video, slow it down, or speed it up. Let's begin. Not every child with an intellectual disability is affected in the same way. You can divide intellectual disability into 4 levels. The first level is the mild intellectual disability. These children can develop to an age of 12 years old. They often have difficulty with reading, writing, and math. It can be challenging for them to function independently. They struggle social-emotionally. They have difficulty holding their own among children of similar age. Children with a mild intellectual disability need clear and simple instructions. Step-by-step guidance helps them become more independent. They benefit from extra support with reading, writing, and math. The second level is the moderate intellectual disability. These children can develop to an age of 6.5 years old. They talk with simple sentences, and their vocabulary is limited. They struggle to see the bigger picture. When several things happen at once, they find it harder to understand what's going on. They also have difficulty building and maintaining relationships. They are often not aware of their own behavior and how it comes across. This leads to misunderstandings. These misunderstandings can lead to frustration. Children with moderate intellectual disabilities often need help with daily activities such as dressing, washing, or eating. They need clear structure in their lives to create a sense of predictability and security. They can learn many things, but they need support. They learn best when things are explained step by step. Using gestures or pictures can also help them understand things better. Next is the third level, which is called the severe intellectual disability. These children can develop to an age of 4 years old. They cannot do their daily care themselves and must be fully supported. They need help with almost everything, such as eating, dressing, going to the toilet. They can process concrete and simple information. It does take more time. They can learn simple actions, such as holding an object. Give them time to process information and focus on simple hands-on tasks, using repetition and encouragement to teach basic skills. Their language is limited. Sometimes they don't speak at all. They communicate through sounds to make themselves clear. It is important to use simple language, gestures, and icons to communicate with them. Contact with others is difficult. Be patient and gentle. Finally, the fourth level is the profound intellectual disability. These children can develop to an age of 2 years old. Many cannot move independently, sit, or keep their head straight. They are completely dependent on others in all areas of life. Thinking and learning is usually not possible for them. They only respond to touch, sound, smell, and light. They use sounds and crying to communicate. Interpreting the message can be quite difficult. When you get to know the child better, it will be easier to understand their communication and needs. Predictability and a good relationship with the child are essential to avoid anxiety or upset behavior. Now that you know more about intellectual disabilities, let's test your knowledge. There will be a case told about a child with an intellectual disability. In the case, you will hear different characteristics linked to one of the levels of intellectual disability. It may help to take notes. What level of intellectual disability do these children have? Case 1. Amina is an 8-year-old girl who lives with her mother, grandmother, and 2 younger brothers. She has difficulty learning, talking, and functioning independently. Amina functions as a child of about 4 years old. She uses short sentences and mainly knows words that often recur in her environment. Her vocabulary is limited, and she quickly gets confused if someone explains something complicated or talks too fast. Her mother uses gestures and pictograms to explain things. Amina needs help with washing, dressing, and eating. Her grandmother helps her wash at the water pump in the morning and put on her clothes. She finds it difficult to do several things at once. If someone says, "Go put on your clothes and then bring the water," she gets confused. She benefits from step-by-step guidance. Amina sometimes plays with the other children in the village, but she doesn't understand the rules of games. She may suddenly get angry when others correct her or when it's not her turn. She often does not realize that her behavior scares others off. She would like to participate, but children sometimes avoid her. This leads to frustration for Amina. Then she cries or withdraws from her mother. With patience and repetition, Amina can learn a lot as long as it is made visual and concrete. What level of intellectual disability does Amina have? The correct answer is a moderate intellectual disability. You could recognize this level by the following sentences. She functions as a child of about 4 years old. She uses short sentences and mainly knows words that often recur in her environment. Her vocabulary is limited. She easily confused if someone explains something complicated or talks too fast. She needs help washing, dressing, and eating. It's difficult for her to do several things at once. Step-by-step guidance is important. She often does not realize that her behavior scares others off. With patience and repetition, Amina can learn a lot as long as it is made visual and concrete. Case 2. Zawadi is a 5-year-old girl, born as the second child in a family of 4. She lives with her parents, grandmother, and older brother in a small village. From birth, her parents noticed that Zawadi was not developing like other children. She cried little, hardly moved, and did not respond to voices or movements around her. Zawadi cannot sit, crawl, or hold her head up on her own. She lies on a mat on the floor most of the day or is carried on her mother's back in a cloth. Zawadi does not speak and has no conscious eye contact. She communicates by moaning softly or crying, especially when in discomfort or when she is hungry. Sometimes she smiles at certain touches, such as when her mother rubs her feet or hums a familiar song. She reacts lightly to smells, soft light, and quiet sounds, such as whistling or singing. Zawadi is completely dependent on her mother for nutrition, care, and safety. Zawadi's mother has built up a very close relationship with her daughter. She knows the different sounds Zawadi makes when hungry, in pain, or when she needs reassurance. She uses a lot of touch, soft voices, and fragrant wipes to reassure Zawadi. Predictable routines are essential. Every day starts and ends the same way, so Zawadi is less likely to get upset. What level of intellectual disability does Zawadi have? The correct answer is a profound intellectual disability. You could recognize this level by the following sentences. She does not sit, crawl, hold her head up on her own. She doesn't talk. She makes no conscious eye contact. She reacts lightly to smells, soft light, and quiet sounds. She is completely dependent. The mother uses a lot of touch, soft voices, and fragrant wipes to reassure Zawadi. Predictable routines are essential. Case 3. Gene is a 10-year-old boy. Gene functions at the level of a child of about 7 years old. He has difficulty reading and understanding what he reads. He would like to participate with other children, but has difficulty making social contacts. He doesn't always understand jokes or sarcasm, which sometimes leads to misunderstandings. He can react impulsively when he doesn't succeed or when he feels excluded. What level of intellectual disability does Gene have? The correct answer is a mild intellectual disability. You could recognize this level by the following sentences. He functions at the level of a child of about 7 years old. He has difficulty reading and understanding what he reads. He has difficulty making social contacts. He doesn't always understand jokes or sarcasm. He reacts impulsively. Case 4. Kofi is a 6-year-old boy. He lives with his parents, grandmother, and older sister on the outskirts of a village. From an early age, the family noticed that Kofi developed differently from other children. He started rolling late, crawling, and still can't walk on his own. Kofi cannot yet sit up properly without help. Sometimes he slides on his stomach on the ground to move around. He also has trouble eating, often spilling or choking. He cannot go to the toilet on his own. He wears cloths and has to be fully helped with washing and toileting. Kofi doesn't talk, but makes sounds like or ah when he's hungry or wants attention. Sometimes he suddenly cries for no apparent reason. His family has learned to look at pitch, facial expression, and body posture to understand his needs. Kofi is completely dependent on his mother and grandmother. They wash him daily. He is sensitive to stimuli. Loud noises, several people at the same time, or new situations make him restless. Kofi sometimes responds to his sister with a smile or by extending his hand, but he makes little contact with others. Playing with other children is not possible. Other children in the village do not understand him well and usually stay at a distance. What level of intellectual disability does Kofi have? The correct answer is a severe intellectual disability. You could recognize this level by the following sentences. He started rolling late, crawling, and still can't walk on his own. He doesn't sit up properly without assistance. He slides on his stomach on the ground to move around. He has difficulty eating. He doesn't go to the toilet independently. He has to be fully assisted with washing and going to the toilet. He doesn't talk. He makes sounds like or ah when he's hungry or wants attention. To understand him, his family listens to pitch and looks at facial expression and posture. He makes little contact. Thank you for watching. We hope you understood everything and enjoyed it as much as we did. Talk about this video with your experienced colleagues.